nicely getting flush. It's a little creepy when I have. This is what filter cap, or in my world, junk. I hate them. I don't use them. I, in fact, remove them and toss them aside. I feel they help you clog the catheter. Some people love them and keep them on. Either way is perfectly acceptable. This end, I'm free to touch, la 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 la, but I'm not free to do this, because I'm contaminating my catheter by doing that, right? Yes, Melissa. Now, can I touch this pink part? Yes. Can I touch anything from the pink part distally? No. Thank you, Maria. So you guys are all used to, if you've given a catheter or put one in, something like this. Now we're going to rock your world. And you're going to do something like this. See how my hand placement changed? What was once my finger to advance my catheter is no longer so. Now it's the finger that stabilizes my stylet. What is a stylet? This upper part, which is actually a very long, very sharp needle. So now I'm going to use my International Sign of Peace finger to advance my catheter once I'm in the vessel and I have a good flow back. Before I do any of that, I am a very strong believer in hep saline prior to advancing your catheter. Large animal, small animal. I got that on tape. So people get a little freaked out when they put their hep saline in and it may not stay there. Does it really matter if it stays in your catheter? No. The idea is that you're coating the inside of the catheter with heparinized saline. It just gives you a little advantage on if you go into the vessel and you get a flashback but you can't find a good flashback or you lose it, gives you a few extra seconds of time to go fishing and find your vessel. If you don't have the hep saline in there and you get a flash, your catheter tends to clot faster. And then you have to come out, get a new catheter. So, here we go.
Do you want me right here? That would be awesome if I could. I'll switch with you.
I have my bevel up or facing me. I have my infusion cap at the ready. Godie's legs are to my side. I'm left hand non-dominant, so that's what I'm going to use to hold off. I'm going to give the goat a second to fill.
The tighter you stretch the skin, the easier you can put the catheter through the bleb and into the vessel.
So holding off and then pulling down will help you immensely versus just holding off or even pushing against. So hold off, pull down, bevel up. I'm going to bring the bevel to the ID bleb I made. When I go through the skin, I'm going to be prepared. It's one shot through the skin, through the vessel. I do not want to see you guys go dig, dig, dig or poke, 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 because you'll just ruin the tip of your catheter. So chew gum, grind your teeth, whatever you need to do, in the bleb and through. I advance about halfway up the catheter. I'm getting a flashback. I'm going to let off. Left hand comes up to stabilize the stylet. Right hand advances the catheter. Do not remove the stylet until you have your infusion cap ready. What will happen if I remove this stylet? Blood will come gushing out, and then what tends to happen is students go, oh my gosh, oh my gosh, oh my gosh. Or you're like me right now. And you can't pull the infusion cap off. Thank you. So I'm gonna do this quick. I'm gonna have a sharp, but I'm gonna throw it off to the side. And I'm gonna grab a dry gauze and I'm gonna gently pull up on the catheter. I don't want to kink it in half or bend it too far. I just want to dry the area. Lay it flat again. Come back for your flush, because now I want to get rid of that blood that's collected in the end of my catheter. You gotta find center on these things, otherwise you won't be able to pass the needle, and I'm not doing a very good job right now. There. I have a 20 gauge needle on a 20 gauge catheter. Keep that in mind. Would I want to have an 18 gauge needle on this syringe and pass it into a 20 gauge catheter? No, because then I could slice up my catheter and that's a very bad thing. So I'm flushing. See how this area cleared out now? That's exactly what I want. Will this area ever clear? No. That's part of your lure lock of the infusion cap, and that you won't be able to get rid of.
Whenever you do your initial hep saline flush, do you aspirate at all?
Good question. What do you guys think? Should I aspirate?
No.
Not for a catheter. If you're injecting, yes, you're checking for placement, but a catheter with a good flashback of blood like that, you shouldn't have to. It's just going to cause clotting of your catheter.
So how would you know that you're in if you're not going to pull back and check for a flash?
The saline and bone.
Saline, it'll go. You could push it in, but what will you see? You'll look for a bubble along the, right at where you think the end of the catheter's 1.25 inches. So where you think the end of the catheter was, it'll start, you'll get swelling. Yeah. If you pulse when you flush, you can kind of feel that in the vein. Yeah, you can.
So if you advance the catheter and then you pull the other part out to put the infusion cap on and the blood just kind of trickles out, like not as good as you thought, you have to remove it and redo it?
You would remove the whole
Okay.
catheter. Yep. You've probably seen people cheat.
Yeah.
Put the stylet back in. That's pretty risky to do because
Okay.
you could completely sever the catheter.
Okay.
And then you'd have a free end of the catheter away into the body. So here's our butterfly. So about 6 inches